and welcome to AgeWise Health. I'm your host today, Madelyn Dedaj, and today in our studio we have with us Jamian, the President and CEO of AmeriCare Medical. Our topic on the show today is the pros and cons of selecting a Medicare Advantage plan over a traditional red, white, and blue Medicare plan once you turn 65 and then thereafter. Hi, Greg. Welcome back to AgeWise.
Thank you for having me, Madeline.
Of course. So I heard the deadline to choose a Medicare plan has just passed, but the good news is if you picked a Medicare Advantage plan and are having second thoughts, you have until March 31st to make any changes.
That is correct. And, we're in that period right now. And if you don't exercise the change during this period, you would have to wait till fall of this year to enroll in the normal enrollment period.
Okay, great. That's very important to know. So, Greg, before we get into our show today, how about you tell us a little bit about yourself and your background in healthcare and the Medicare field?
Sure. I grew up in Michigan and specifically Birmingham, Bloomfield Hills area, and went to Oakland University, got a degree in economics. And soon after that, I entered the insurance business, health insurance. And so that's kind of where I started with my healthcare background. I later decided to be an entrepreneur, and back in 1980, 45 years ago, I started a company with a partner of mine called Sun Medical back then, and it still exists today. And the company just grew into nursing services, pharmacy services, basically home-based. And so we're really happy. I'm really happy with the growth and the ability to serve the public. But I also sit on the School of Nursing Board at Oakland University. And Madeline, it really helps me, stay on top of, latest trends, best practices in nursing care, and since such a large part of our business is nursing, I find it really helpful. I think I know a little bit about Medicare. I know a little bit about insurance. I know a lot about healthcare, and hearing the concerns from our patients over the years regarding different types of coverages that they have, and of course some coverages we can take, some coverages we can't. But I've kind of learned what kind of Medicare programs, really work the best in most cases.
Okay, great. Yeah, it sounds like you're an expert on this topic, so it's great that we have you here to talk about this. So can you start off by telling us the basics of what traditional Medicare is?
Sure. Medicare started in 1965, I think, under Lyndon Johnson. And back then they used to call it the three-layer cake. The first layer would be hospitalization coverage for elderly. And then the second layer was some kind of physician program where physicians you could go to a physician and Medicare would pay for the expense of seeing a physician. And then the third was kind of a expansion on Medicaid. You have to be 65 or older to sign up, and there are special situations and considerations for people that have certain diseases, end-stage renal failure, to just name one, but there's many others where you could qualify for enrollment earlier than age 65. That we have under Medicare, and I like to say the red, white, and blue because the red, white, and blue refers to the original traditional Medicare plan, which, in my opinion, is the best option out there for most people. But there's Part A, which is the hospitalization piece, and that doesn't cost the enrollee any monthly fees, or it's there's no money involved on a monthly basis. And then there's Part B, which covers things like physician services, other, some durable medical equipment, sometimes exams and x-rays and certain things like that. And there is a fee for Part B. And in 2025, that fee is about $185 per month per enrollee. And again, Part A is free. That covers the hospitalization. Part B picks up some of the extras. That's $185. And then a lot of people will get a Medigap policy to pick up and pay for some of the deductibles on top of that. Then there's a Part D, which many people are probably aware of, and that's the drug coverage, the pharmacy piece. And there's various plans available there with different forms of deductibles. The higher the deductible you get, the lower the premium. If you want a low deductible, then you're going to pay more for that. And then there's also the Part D, Part B deductibles. Usually, going back to Part B, they usually run about $185 a calendar year. And then there's a 20% coinsurance on top of that. So, there are some costs, but when you compare it to the cost of care, and health care is expensive, and no one's going to apologize for that here, because, providing health care is a very complex type of work and process. Mm-hmm. And there's expenses that go along with it. So what Medicare actually pays for is amazing. It's an amazing amount on average per enrollee. And let's face it, as we all age, the incidence of treatment increases.
Absolutely, yeah. There's a lot there, so thank you for sharing that. Mm-hmm. So with traditional Medicare, does this include deductibles and coinsurance?
Yeah, so, again, the Part D, Part B deductible for 2025 is $257 a year, a calendar year. And then there's the 20%. And let's say some people get this Medigap insurance to cover those deductibles. Mm-hmm. And that runs about $217 a month. So all in, you're close to $400 or $500 a month for the traditional Medicare. But the cost up front on a monthly basis may be a little bit higher, but should you need the care, you have, great benefits.
Right.
So someone once said, I can plan for the $300-400 a month, but I cannot, as a senior, plan for the unknown if you, for example, have to be hospitalized for, an extended period of time.
Absolutely. Okay, great, thank you. So do most healthcare providers accept Medicare?
Well, that's a good thing about the traditional red, white, and blue card, is that you can go pretty much anywhere in the country, and it's highly welcomed.
Great.
People know what they're getting into. I'm talking about the providers. So when you go see a provider, a lot of these providers are business people too, the hospitals, the doctors, the physical therapists, and they want to get paid a fair amount, a fair wage for what they do. Mm-hmm. And, with the Medicare, traditional Medicare, that's pretty much guaranteed that there's going to be fairness there. Unlike some of the other options that are available, like the Medicare Advantage plans that, are not looked at so highly by providers.
Okay.
Here's the thing. If I'm going to a doctor, I want that doctor to be happy when he sees me. Right? And when I go into a hospital and check in, I want them to say, oh, you got good coverage, And the traditional Medicare red, white, and blue is great coverage and welcomed all over the country.
Well, that's great to hear. Yeah, absolutely. So could you tell me a little bit about what prior approvals are and how they affect someone's access to the care they have under Medicare? Sure.
Prior approvals are a nifty little tool that insurance companies use to ration care. And they're becoming way more cumbersome nowadays than they have in the past when they were first introduced. But basically, for certain types of tests or treatments, you have to contact your insurance company or Medicare and get permission from them, even though your physician has ordered the treatment or the test. It's not enough. You have to go to your insurance company and get permission. Under Medicare, traditional Medicare, those prior approvals are limited and they're reduced. Now, when you go to an alternate option like a Medicare Advantage, which we'll talk about later, everything you do basically requires a private approval, and denials of your care going forward are frequently denied.
Right, which can be not great for anyone who's expecting to receive care.
Exactly.
So when you're in Medicare plan, can you still go see your own doctor or preferred provider?
Yeah, that's the great thing about traditional Medicare. You can go see your own doctor. No one chooses your doctor for you, and you can go to see specialists without a referral. Because under the other types of programs like the Medicare Advantage, you need a referral to go to see another doctor and have that visit paid for. So you can see your own doctor. You can select your own hospital. And let's face it, there's a lot of differences from one hospital to another.
Absolutely.
So if there's a hospital that focuses on treatment of cancer or heart disease, you're free to pick which one you want to go to. And 98% of them accept Medicare.
Wow, that's great. Yeah, absolutely. It's important to be able to choose your own provider. So I know that you need to be over the age of 65 to be on Medicare. And, it gets colder in places like Michigan. People like to travel to places where it's a bit warmer. So for someone who may be like a snowbird and wants to visit somewhere like Florida in the winter months, how does that work when you travel between states?
It's frictionless, Madelyn. And so you're right. A lot of people have, go down to Florida for a couple months or go to Arizona. And that's the great thing about having the traditional Medicare. It travels with you. Unlike, some of the limited plans that, you have to get a prior approval for the hospital you go to as well.
Great. Yeah, that's great, because I know that it's nice to be out of the cold weather every once in a while.
It is.
So, does traditional Medicare cover specialized hospitals like the MD Anderson or the Cleveland Clinic?
They sure do. In fact, I visit Cleveland Clinic once a year for an annual checkup, and sometimes it's in Florida, sometimes it's in Cleveland, and it does not matter.
That's great.
That's another great thing about the original Medicare plan.
Absolutely, you can go anywhere.
Yeah.
So what are the other options available besides traditional Medicare that we've been talking about?
So there's Part C, and you've seen it on television, you've heard it on the radio, and that's the Medicare Advantage programs. And there's some decent ones, good ones out there, but there's a lot of bad ones. And a lot of seniors, in my opinion, are getting tricked into joining these and giving up their traditional Medicare benefits to get into one of these plans just because they offer a free gym membership. So they offer a free gym membership, but then should you really need the care,
right?
They're short and there's limits, and they're short on delivering the care. So it's something that people have to be careful of.
Okay. So if someone's deciding in between two plans, what are some key things they should think about when picking what's best for them?
Sure. Well, affordability is always a case. Access to the care that you need, because remember, with Medicare Advantage plans and prior approvals, excessive prior approvals, there's people making those decisions for you that are not physicians. They're insurance companies that flick a switch. So geographic location, formularies, and we can get into that later. And so you have to ask yourself, are the extras that you might get through a Medicare Advantage worth giving up your traditional Medicare coverage? So those are just a couple things. Daily limits in hospitals. A lot of these plans that, the traditional Medicare does not, but the Part C plans many times have limits.
Okay. Thank you, Greg. That's very informative.
Sure.
If anyone wants to find out more information on this topic, where should they go?
I recommend they go right to the government that offers it, and that's, you can call 1-800-MEDICARE and get a totally unbiased view and opinion, and it's instructional on what to do next. And then also you can go online, Madelyn, Medicare.gov.
Great. Thank you so much, Greg.
Of course.
Thanks for joining us today and telling us a little bit more about the pros and cons of the Medicare traditional plans and the difference between them. We appreciate the time that you've had to be here on the show with us today.
Well, thank you.
Thank you for joining us today on AgeWise Health on the pros and cons of Medicare Advantage plans and traditional Medicare. If you have any questions about today's show, please give us a call at 248-288-2270. This has been AgeWise Health. Stay safe and healthy.